Between 12,000 and 15,000 British Columbians were living with HIV in 2010. Approximately 300 British Columbians would be diagnosed with HIV in 2011.
I was diagnosed March 23rd, 1993 at 2 o'clock p.m. That's a date I'll never forget. He said to me, he goes, the bad news is that you're going to die and there's no cure for what you have. And he walked out. I went into shock. I didn't know what to do.
I feel like lots of times when I'm going into my doctor's office, like my specialist, I'm not being heard. You know, like I'm looked at and I'm being told it's all about the numbers. And there's nothing more frustrating than when I know that I'm not feeling well enough, that I can barely even make it out of my house to get to work, that my eyes are glowing fluorescent yellow, and that, you know, I'm pretty much feeling like I'm dying, and he's not understanding this, and he's going, it's all about the numbers. It's all about, you know, it's textbook, and I'm going, no, like I'm dying, you know, and not being heard is just, it's a huge issue.
Well, if I define care as being seen and being heard and being listened to in addition to being given treatment when I need it, then I would say hearing me out and not diagnosing me with your back to me or looking in a chart or understanding a common issue and just saying that's definitely what it is. Overall, that's the most important thing to me in my care, being listened to.
Before the collaborative, we're feeling a bit more isolated in the care delivery. And when meeting patients where there was gaps in care or certainly suboptimal care, one felt rather isolated in terms of how to address the barriers to that. I think that was probably a significant frustration, just a bit more the isolation and not knowing where to go to try and re-engage a patient for care.
I felt quite isolated in the community and in interior health. We had very little collaboration between different partners. We had no communication with the community provider that does support for HIV patients.
The aims of the Stop HIV/AIDS Structured Learning Collaborative began to improve access to high-quality care and to improve health outcomes for people living with HIV and AIDS in BC, while strengthening linkages to care and partnerships.
But unless you bring the people who the problems are being solved for to the table, I don't think you're going to get the best outcome. So offering the opportunity to bring patient voices and perspectives to the table, to the conversation, I think that probably is the key.
Although highly active antiretroviral therapy has transformed HIV infection into a chronic condition for many of those who engage in care, this life-saving treatment remains underutilized in British Columbia.
Starting in 2003, with the support of the provincial government, we re-expanded antiretroviral therapy use, which had been flat for a period of years between 2000 and 2003, with also a flattening on the HIV new diagnosis. And we found that, indeed, when we expanded the number of people on treatment, the number of new infections also went down. So at the end of the day, I think that the consensus is here. Treatment is prevention, but it's not just prevention of HIV transmission. It prevents morbidity, it prevents mortality, and it has an additional benefit in decreasing HIV transmission. All of these to a very high level.
Under the auspices of Treatment as Prevention, the Stop HIV/AIDS Structured Learning Collaborative was launched in December of 2010. The initiative brought together 16 multidisciplinary and diverse healthcare teams from across British Columbia.
Unfortunately, we cannot take an easy way out of this. We cannot do one thing. If all doctors were convinced all of a sudden to treat all of the people with HIV, it makes no difference because there are multiple barriers for people to get to the doctor. So the only way we can fix this is working together throughout the continuum of care and with the societal element to ensure that we can make this work.
The collaborative really starts by acknowledging the gaps, by identifying those gaps between knowledge and practice, So knowing that we have standards of care that are well developed and scientifically based, but not necessarily being applied.
It's structured as what's called a breakthrough series collaborative, which is essentially using adult learning methodology, brings people together around shared goals and a topic for improvement. And then it allows us to learn together and then increasingly over time to be able to share what we've learned.
I think one thing that we have not done yet is to really learn from each other. I think the ability to learn from other programs. So if I come up with a tool, a resource, a great idea, it sometimes, unfortunately, stays within one clinic. So the advantage we have here and the gap that we try to overcome is the silos that are part of our healthcare system.
I would say that at the beginning of the collaborative, it seemed like a very a monumental task to actually have this collaboration between the health authority, between aid service organizations, and between primary care. I think that there was some hesitancy or some concern that that actually wouldn't become a reality, and it has, not only in the Prince George area, but in Smithers, and now we're going to be able to roll out different strategies in other outlying communities, and that's an incredible success.
I think we've recognized that some of the care we deliver is delivered well, but for patients that are not able to access the care, of barriers, that we didn't really have a very good process in terms of identifying them and sort of in a formal way trying to re-engage them for care. So case management seems to be the way we've started to do that, and particularly with the focus on outreach. A patient that had gaps in care and ended up hospitalized, we were able to visit in hospital, as was the outreach team, because of our case management. And the patient said directly to me, you know, I can't believe it, outreach came and saw me, you came and saw me, I feel like you guys really care about me. So that was sort of, you know, a direct positive patient feedback.
Participating teams embarked on a 13-month collaboration, during which time participants and patients engaged in a process of sharing and learning and applied quality improvement frameworks to advance the health status of people living with HIV and AIDS in British Columbia.
Hopefully those, you know, not only like friendships, but working professional relationships will continue, and we can continue to always say to a clinic down in Vancouver, hey, have you guys tried this, or you thought about this, or do you have this form? We can share that. As well as patient voices, for sure. We always thought that we wanted to have a patient voice, but we didn't really know how to do it. And then to know that it's not only less work at the end of the day, there's such value from it. So by far was actually including a patient voice in a lot of work we do, or the programming and planning that we do. So it's huge.
Because now we have actually people talking to one another on a regular basis, and there's actually a team that people can turn to for when someone's stopped come to the door and they find out that no one else is looking after them, to actually try and re-engage those people. So I think that's sort of from the beginning till now, I think, something that we're quite proud of.
I'm able to take something from this, and they're also able to gain something from me. To be heard, to listen, to gain knowledge. I'm very grateful to be here today. I think it's very important.
What I love is that it's brought in teams across all over the province together to share resources, their ideas, their own clinic successes and challenges, and I think there has been great learnings among all the teams here, and a great desire to share.
It's one of the first times that we've brought all the different stakeholders into the room to actually engage in conversation, respect the diversity of the room, and actually go forward with solutions that we actually are communicating in a meaningful way and building relationship and building trust. This is a big breakthrough.
The collaboratives offered great support from a professional level. It actually lets us see that what we were doing was good work, we just didn't know it, and it's really given us pride in what we're doing.
For me, this collaborative has been about bringing people together and communicating, and that I think is an ultimate goal in almost anything we do in life.
So we're in a very solid foot to recommend a greater investment on antiretroviral therapy rollout programs, which include everything from testing to treatment to support and all of the ancillary measures, because in doing so, we can stop the epidemic.
For more information on the Stop HIV/AIDS Structured Learning Collaborative, go to stophivaids.ca.